Okay. My topic is about complication and reoperation in metastatic spine surgery. I have nothing to disclose. So peri-op complications should be minimized in patients with spinal metastasis who have a limited prognosis. So therefore, a better understanding of these complications is necessary. So although there are many studies about complications in metastatic spine surgery, most of them are old retrospective studies with small sample sizes which could not perform adequate risk factor analysis. So in this study, we evaluated post-op complications, reoperation, and the risk factors in metastatic spine surgery using data from the Japanese multicenter prospect study. So subjects were patients who underwent surgery for spinal metastasis registered in the JASA multicenter prospect study. Our primary outcomes were post-op complication within 6 months and reoperation within 1 year. We also conducted a risk factor analysis with those tumor-related factors, pre- and post-op treatment history, surgery-related factors, and pre-op ADL and QL scores. So here is the result. So 365 cases were included in this study. The most common primary site was lung, followed by kidney, breast, and prostate. So 112 complications occurred in 101 cases. 1/3 of the complications were due to wound complication or neurological deterioration. So univariate analysis between the complication group and the non-complication group showed the proportion of male sex was higher in the complication group. As for the pre- and post-op treatment history, the complication group had more pre-op radiotherapy and less post-op chemotherapy. So in terms of surgery-related factors, the complication group had more invasive surgery, longer surgical time, and more intra-op blood loss. Also, the rate of emergency surgery was higher in the complication group. So regarding the pre-op ADL and QL scores, the severity of the Frankel classification was higher in the complication group. And multivariate analysis showed that pre-op radiotherapy, emergency surgery, male sex, and longer surgical time were independent risk factors for post-op complications. So as for the reoperation, 36 reoperations were performed in 35 cases, and the most common cause was the loss of local tumor control. Multivariate analysis identified pre-op radiotherapy as a risk factor, while post-op chemotherapy as a risk-reducing factor. So discussion. So the complication and reoperation rate in this study was similarly high to those reported in the previous studies. Although various risk factors for complication have been reported today, this study identified male sex and emergency surgery as new risk factors. So regarding the emergency surgery as a risk factor, patients requiring emergency surgery are likely to have severe SRE, such as severe paralysis or pathological fracture, which have been reported as risk factor for post-op complication. So in recent years, multidisciplinary treatment for spinal metastases have been reported to prevent SRE and reduce emergency surgery. So therefore, from the result of this study, so multidisciplinary approach for spinal metastasis is also beneficial to reduce post-op complication. So in conclusion, the post-op complication and reoperation rate in metastatic spine surgery were relatively high at approximately 30% and 10% respectively. Pre-op radiotherapy, emergency surgery, male sex, and longer surgical time were risk factors for post-op complications. Also, pre-op radiotherapy was a risk factor for reoperation, and post-op chemotherapy was a risk-reducing factor. Thank you for your attention.